This short video shows how to properly set up, connect, and operate the NONIN RespSense capnography monitor and the LifeSense capnography and pulse oximetry monitor. The RespSense monitor uses side-stream, non-dispersive infrared spectroscopy to continuously measure and title CO2 and respiration rate. NONIN Medical's RespSense capnograph with proven CO2 detection technology offers the earliest indicator of an adverse breathing event. The LifeSense capnography and pulse oximetry monitor adds SpO2 and pulse data collection for all-in-one respiration rate, pulse rate, carbon dioxide, and oxygen saturation monitoring. The capnography functions are the same on both the RespSense and LifeSense models. The additional LifeSense SpO2 and pulse function will be described later in this video. Both monitors can be used with a nasal cannula or with a sample line attached to an endotracheal or tracheostomy tube via a T-connector and side port. Use only NONIN-approved sample lines available from NONIN Medical. The monitor has a wide touchscreen for easy programming and operation. It can be run with a NONIN-provided power supply attached to standard AC wall power or internal rechargeable battery pack. Using an incorrect power supply can give inaccurate results or damage the unit. The capnography monitor is ideal for both stationary and mobile monitoring applications, as well as for continuous monitoring or spot checks. All operations are performed on the touchscreen display. Setup consists of a monitor, moisture trap with filter, nasal cannula or T-connector and sample line, and the power supply. Moisture traps, filters, and sample lines are single-use components and disposed of after each patient use. Start each patient with a new sample line, moisture trap, and filter. Remove the used moisture trap from the monitor by pulling on the tab to snap it out of the housing. Then remove the filter. Open the new moisture trap and filter and place the filter into the slot on the top of the trap. Insert the moisture trap into position on the side of the monitor. Use the marks in the trap opening on the monitor as a guide to properly insert the trap. It will snap into place. Have a supply of replacement moisture traps and filters on hand. 3 sizes of nasal cannula are available for adult, pediatric, and infant use. Place the nasal cannula and snugly attach the sample line to the moisture trap using the lure lock stem on the trap. T-connectors and sample lines for patients on supported ventilation are also available. We also recommend using Nafion tubing for ventilated patients receiving added humidification to reduce moisture buildup. Proper sample line placement and routing help prevent kinking occlusions or moisture buildup in the sample line. Keep the sample line clear of monitoring, IV, or other lines attached to the patient. Turn on the RespSense monitor by pressing the on-off button in the upper right corner until you hear a beep. The monitor will run a brief self-test. After a few seconds, you will see several entry selection screens to choose initial settings. Alarms remain inactive for 2 minutes after starting the monitor. The first screen allows you to enable or disable alarms. The Disable Alarms icon drops all minimum alarm values to 0. You will then see the main screen. The Enable Alarms icon sets alarms to the default limits. The next screen lets you choose the patient size. You will then see the main monitoring screen. Alarm limits will appear on the display. The monitor always resets to the default alarm limits for your selected patient size at power-up. The default alarm limits are available in the operator's manual. You must reset the alarm values to your chosen limits if they are different than the default settings. Limits are easy to reset. Simply press the up or down arrow in the bar next to each value to scroll or tap to the desired value. Remember, if you turn the monitor off, alarm settings will return to the default limits at the next startup. The monitor is now ready for use and will display data on the screen. You can see the patient's end tidal CO2 value and respiration rate on the display. The trend graphs indicate the end tidal CO2 and respiration rate trends for the last 1.5 hours, with markers at half-hour increments. The monitor will alarm if the end tidal CO2 or respiration rate goes outside of your set limits, or if no breath has been detected for 25 seconds. You will hear a rapid beep sequence and a flashing of the limit exceeded on the display. Other alarms with a slower beep speed may occur, indicating an equipment-related event you need to resolve. You can silence the audio alarm for 2 minutes by pressing the alarm silence button. A second press will resume the audible alarm. The audible alarm and screen message will stop once the problem is resolved or readings are within the alarm limits. The battery charge level displays a black bar in the battery icon. The display will indicate when you must recharge the battery. The monitor can run up to 8 hours on the internal battery when fully charged. The battery will charge when the unit is plugged into wall power, whether the monitor is in use or turned off. The charge indicator will illuminate green when the battery is charging. The LifeSense capnography and pulse oximetry monitor has a cable connector on the right side of the monitor to attach a NONIN Pure Light brand SpO2 sensor. The LifeSense monitor is designed for use with NONIN brand sensors only. Do not use the LifeSense unit with other brand sensors and follow the sensor instructions for use for proper sensor placement and care. SpO2 and pulse rate displays on the left side of the screen along with the ET, CO2, and respiration data. Following use, you can clean the monitor with a soft cloth moistened with isopropyl alcohol. Allow the monitor to dry completely before use. Complete information for RespSense and LifeSense monitors can be found in the operator's manual provided with each product. A nurse call cable, NONIN's TrendSense data collection module, and NONIN SenseDAC cable for sleep labs are available for use with the RespSense and LifeSense monitors connected at the serial port. You can find additional use information on this and other NONIN products at www.nonin.com. RespSense and LifeSense capnography functions should be recalibrated every 6 months, or if the CO2 waveform appears elevated. The pulse oximetry functions of the LifeSense monitor do not require calibration. Calibration is typically performed with a calibration apparatus available from NONIN Medical. If you do not have a calibration apparatus available, you may follow the same procedure to calibrate the monitor with ambient air. 5% CO2 verification gas and a sampling valve are also available from NONIN Medical. These may be used at any time to verify your monitor is in calibration. First, attach the calibration apparatus to the moisture trap. Turn the monitor on. When the NONIN logo appears, press and hold the audible Alarm, Pause, Resume button. Keep that button pressed and press the Power On/Off button at the same time and hold. Calibrating will appear on the display. Then, release both buttons and allow approximately 15 minutes for the monitor to complete the calibration process. The display will return to the normal operating screen when completed. Disconnect the calibration apparatus. To perform the verification procedure, attach the 5% CO2 verification gas bottle with the valve to a sample line with a T-connector on the valve. Verify that the gas valve needle is in the green zone of the dial indicator. If the gas valve needle is in the red zone, the CO2 bottle is empty and should be replaced. One CO2 bottle can be used for approximately 100 verifications. Connect the sample line to the trap. With the monitor running, open the valve on the gas bottle for 4 to 6 seconds to deliver about 200 milliliters of gas. This approximates 1 exhaled breath. The ET CO2 reading should be between 34 and 42 millimeters of mercury. If the reading is out of range, install a new moisture trap and filter set and reattempt calibration and verification. If readings remain out of range, remove the monitor from use and contact NONIN Medical Technical Services for assistance. You can find additional use information on this and other NONIN products at www.nonin.com. There are several steps you can take to ensure proper function of the RespSense or LifeSense monitor before and during operation. To ensure the filter and moisture trap are properly installed, turn the unit on and start without connecting the sample line cannula. Disable the alarm. You will see warm up and no breath displayed as the unit turns on, and the pump will be running. Press your finger over the stem where the sample line attaches to the filter and trap assembly. Within a few seconds, you should hear the pump slow and see the occlusion alarm. Press the Alarm Reset button to clear the alarm. If you do not see the alarm within 5 to 10 seconds, recheck the installation of the filter and moisture trap. You can periodically check the unit's occlusion and trap full alarm functions. With the unit running, with no cannula attached, remove the filter and moisture trap assembly. Press your finger over the small hole in the filter and trap slot. Within 5 to 10 seconds, you should first see the occlusion display and the trap full push alarm display. Press the Alarm Reset button to clear the alarm. If these do not occur, remove the monitor from service and contact NONIN Medical for service. If the trap full push alarm occurs during use, press the Alarm Reset button. If the monitor continues to occlude after 2 alarm resets, occlusion will display, followed by the trap full push alarm. Change the cannula or filter. You can determine if the occlusion is in the cannula or filter moisture trap combination. Disconnect the cannula and press the Alarm Reset button. The monitor will start running. If the unit alarms and displays the trap full push alarm within 15 seconds, the moisture trap or filter may be occluded and should be replaced. If the monitor runs more than 15 seconds without an alarm, the cannula may be occluded. Check and replace the cannula as required. SpO2 and pulse rate monitoring will generate an alarm if the readings fall outside of the default or preset limits. The audible alarm can be silenced with the Audible Alarm Pause Resume button. The alarm will clear when the readings return to the limits on the monitor. Sensor signal strength alarms may occur if a problem is detected. If an alarm occurs displaying no probe, no finger, artifact, or signal low, check the position of the sensor on the patient and connection of the cable to the monitor. Other systems alarms can be found in the operator's manual for each monitor model. You can find additional use information on this and other NONIN products at www.nonin.com.